All right.
All right. So I'm Gary Braver, and I'm here with Adam from Nicaragua right now. Adam, can you state your full name and what you're doing down in Nicaragua?
Sure. I'm Dr. Adam Friedman. I'm originally from Cleveland, Ohio, and I've been down here in Nicaragua for about 15 months. And I came down to volunteer with a nonprofit organization called Natural Doctors International, and it was started back in 2004. And we basically treat the local inhabitants of the island for free with natural medicine, and that involves lots of donated supplies, supplements, vitamins, um, anything that a naturopathic physician might be able to utilize to help the people of the island. We also treat the foreigners that live here, and there's a growing population of expats who've come down, and we treat them by donation. Um,
Hmm.
but the locals, the Nicaraguans, they get treated for free. And we're basically a family practice walk-in clinic, and we see everybody, and we treat just about everything. That's not an emergency, but we've become the go-to clinic for women who are going to have a gyne exam, pap smears, things like that. Just because we've developed this reputation of having a soft touch as opposed to the Nicaraguan system, which is sort of a wham bam thank you ma'am
Hmm.
approach. Um, but the real difference between what we do and say an allopathic physician, an MD, is we take the time to learn about the person sitting across from us. And whereas an MD might be forced to see 30 to 50 patients in a day, we'll frequently take an hour with a single patient if that's what they need. So the people here are very poor. Nicaragua is the second poorest country in the Western Hemisphere behind Haiti. And especially the people here on the island. So the island is called Ometepe, and it's comprised of two volcanoes, one active, one dormant. And there are around 40,000 people that live on this island, and there are currently only two hospitals, one sort of one and a half hospitals, and then various centros de salud or health centers in the various pueblos or small towns around the island. And healthcare here is very primitive at best. It's free for the people of Nicaragua because it's a socialist country, but frequently the hospitals don't have the medicines or they don't have the right kinds, and in which case the people are then forced to go to the private pharmacies where you can buy anything over the counter, but you have to have the money. And the islanders, for the most part, make the equivalent of $1.70 a day, and they will work in the fields from 6 a.m. to 10 a.m., and then it just gets too hot. But they're all farmers, and they're mostly working to survive. They live on a diet of beans and rice 3 times a day. Occasionally, there's some chicken, eggs, fish. They get fish from the lake, and then a few starchy type vegetables
Hmm.
with some fruits. They've got some delicious, very sweet fruits. But as a result of how they've been forced to farm to live, um, their diet is poor, and many of the problems that I see in the patients here on the island are the same that I would see in any first world clinic, just because of the amount of sugar or simple carbohydrates that they ingest
Hmm.
as as necessary for them to live. It's not a, a diet to thrive; it's a diet to survive.
Hmm.
So
Hmm.
they eat beans and rice because it's a complete protein. They get all of their essential amino acids.